I want to talk a bit about the importance of sending patients home with a movement to perform for just 1, 2, or maybe 3 days. As we say a lot, you can't make someone better unless you know what the problem is, and getting the answers over testing over a few days is really part and parcel of that process. So typically it looks like we send patients home with about 10 movements to perform every few hours. Sometimes if repeated movements don't seem to have any promise in the clinic, we'll send people home with a sustained position. But the gist of why we do that is not, oh, let's see if this makes you better. It's more about, let's see what effect this has. Clearly, our overall goal is to make people better, but you have to understand the problem first. So if we think about it in generalities, joint problems, which are the most prevalent problems in orthopedics, will respond quickly to movements. If we have the right movement, they'll obviously respond favorably and get quite significant change in the course of just 1 or 2 days. If we have the wrong movement, as we instruct patients to do, they'll stop. And if we have a joint problem but we have a movement that doesn't make an effect, the patient will obviously come back the same. Now, in contrast to joint problems which change for better or for worse quickly with specific directional preference exercises, tendons and muscles and other problems, including non-musculoskeletal problems, will typically not change that much over the course of a couple days. So when patients come back, it's really important to have in the back of our minds not only, oh, do we make them better, but what happened? Because if I suspect a tendon problem, but I want to rule out a joint problem, I can send a patient home with the directional preference exercise that I suspect will give me the most information. And so if they come back the same, then I can further rule in a tendon problem. But if I suspect a tendon problem and I say move your shoulder into abduction 10 times every 2 hours with this small weight and they come back at least 30% better, well then I'm starting to think that something is going on inside the joint, because that's typically the kind of problem that sees significant change in the matter of a couple of days. There are derangements in the joints that are resolved in a day, right? Especially if the patient is young and healthy and it's only been there for a few days or a couple weeks. That is not uncommon. But we can test it over the course of 2 or 3 days in general, even if one day gets us good results just because of scheduling purposes. But what we don't want, or what I don't want personally, is I don't want people going home and trying to get it 6 times a day or 7 times a day at home for a week or two and then coming back the same, because we could have gotten that information in 2 days. So we want to make the process efficient so that we can get people better faster. And secondly, so that we don't have patients who lose interest in the process. So education is a big part of what I do, and I'm telling people, we're doing this exercise because it's going to tell me what structure is really affected. And I expect this kind of change if it's this, and I expect this kind of change if it's not. And so it's a ruling in process to do the testing at home, but it's also a ruling out process to do that testing over a couple days at home.